Our patron order, we're gonna go on the sign-up sheet if they're physically present. It goes Delegate Rodman, Delegate Byron, Delegate Price, Delegate Freitas, Delegate Garrett, Delegate Horrock, Delegate Ingram, Delegate Robinson, Delegate Boysko, and Delegate Yancey. And we are 5 minutes late. If you are a person that would really like to see Democratic members up here, contact them right now. We're going to get started. Delegate Rodman, you are up first with House Bill 1383. You have a seat.
Thank you. My first time with you all. Thank you. Madam Chairman, members, thank you so much for having me. I bring to you HB 1383. It was brought to me by a constituent, Arnold Woodruff, and the Virginia Association for Marriage and Family Therapists. It simply amends a section of the code to reflect an industry practice, current industry practice regarding marriage and family therapy. This is just language to be clarified for licensed marriage and family therapists. It's substituting simply the word appraisal for assessment and takes advantage of the current definition. Assessment actually isn't in the code, but appraisal services is, and which includes the ability to diagnose and utilize objective assessments, which I think is the industry practice as it exists. I should have Arnold Woodruff from the Marriage and Family Practices Association here.
All right, thank you for that explanation of your bill. Are there any questions from the subcommittee for the patron? Is there anyone in the audience that has concerns about this legislation? And hearing the track. Is there anyone that simply feels the need to register their support, recognizing that right now you're in a good situation? All right. Is there a motion?
Move to report.
Second.
All right, is there any discussion on the motion to report? As many as favored the motion to recommend reporting will vote aye.
Aye.
As many opposed, no. And that passes out on a 5-0 vote. You do not need to come to full committee.
All right.
We're gonna make one change to the order. Delegate Yancey, you're up. You weren't on the sign-up sheet because you were over in another committee. We wanna get you back there so you can pass those good Senate bills. So, House Bill 330.
Thank you, Senator. Senators, House Bill 330. This bill was brought to me by members of the Virginia Oncology Association, which are here today to speak to the bill. And what it says is, Mr. Chairman, that sunscreens are treated by the FDA as a drug. And as you know, in Virginia schools, if a child has a drug on them, obviously they would face some rather stiff discipline. So what the bill seeks to achieve is that those students who come to school to wear a sunscreen when they're outside and protect themselves from any potential threats of skin cancer future in their lives would be able to carry this drug on them without having any concerns about disciplinary issues. And to the point about whether or not it's a drug that is treated by the FDA, which I have here from the Food and Drug Association, it says sunscreen products intended to protect consumers from the sunscreen are regulated as drugs. But Dr. John Madden speaks specifically to the issue of drugs, the regulation, and why this bill is important.
And Mr. Chairman,
Senator Carrico.
this bill was in my education committee, and that was one of the questions that was brought up. Is this a drug or is this just FDA approved, like Claritin or anything like that you can buy over the counter? And I think that's why it's referred to this committee.
And so, Mr. Chairman, we do have Dr. John Madden who can speak specifically to some of the concerns that you might have.
Thank you. Are there any questions from the subcommittee for the patron?
I will say we did have a discussion about over-the-counter versus prescription medication, but I think the real concern for me on this bill is the idea that we're codifying a single thing that is to be allowed in schools as opposed to letting the school boards decide what their policy will be for medications at a school. And I think it has the potential to make the code cumbersome, and that we'll have to go back and strike things if all of a sudden we have a sunscreen pill. You know, and I feel like we are overreaching to codify these kinds of expectations that could be so reasonably handled at the local level with a policy. And so that's my concern for the bill, and I'm probably gonna vote against it for that reason, because I foresee us, I am opposed to legislating standard of care. policies in schools right now for ibuprofen or something else that the parents wanna send in, they just have to sign a release, and that's my concern about the bill, Mr. Chairman.
Thank you. Senator Peak.
Thank you, Mr. Chairman, Delegate Yancey in the House and the other committee. And I think we were all just shocked that we have to, at the state level, pass a bill to allow sunscreen into school. And I don't think you were here, I think you were in another committee. Was it one particular question to the chair, to the patron, Mr. Chairman? Was this one school board, one incident is what we heard?
Mr. Chairman, I think, well, if it's okay, I can have Dr. Matter come up and speak to what he's seeing from the medical side of more young people coming to his office with skin cancer issues.
But that's why would we not want them to take sunscreen? I know.
And so in speaking with the school board in Newport News, not that they're opposed to the bill, but the concern is obviously they have policies in place to the senator's concerns, obviously, and I would certainly respect that, but the problem is it's a double-edged sword. On the one hand, they have policies in place that if any child breaks the drug policy, they're going to be held responsible, and they could be facing suspension or expulsion or the like. And on the flip side of the coin, like children that are going out, they're outside for many hours, they're exposed, they get sunburned, and then the next steps happen. So it's that delicate balance which the senator brought up, and certainly can appreciate that. But here we have a situation where Dr. Matter can speak to what he's seeing from young people coming into his office and the concerns that they have on treating skin cancer, with the flip side of the coin, which is potentially government going overboard on these kinds of issues.
Mr. Chairman.
Senator Peak, first, right now we're gonna do, anyone that has any other questions, and I think the patron has someone, that's gonna try to help him make a case for this. So first, right now, we just want to explore where we might have concerns so that he can make that, and then we'll hear from anyone else. Is there any other questions from the subcommittee?
Yep, I have one, Mr. Chair.
Yes, Senator Peak.
Delegate, we are not at all, but I want to be clear, we want everybody to have sunscreen. What our shock is that school boards lack so any iota of common sense that they can contemplate expelling someone from school or suspending them or disciplining them for taking sunscreen to school. And that is, I think, what perplexed us at the last subcommittee.
And Mr. Chairman, I respond, Senator, to your point, I recall when I came into my freshman year, one of the senators who came in the freshman class that I was in 2011, who's now a member of the United States Congress, was, I believe he introduced, or it was either Senator Stanley introduced some legislation in concerns because young people would take, say, a pencil, and they would form it as say, maybe I hate to use the word weapon, but they would take something where, you know, the kids being kids, take a rubber band and they shoot it and having fun, and that was considered a weapon, and the children, and they were considered a weapon, and they were being held, they were facing disciplinary issues when something that every child has probably done, just a force play, and now they're being treated as a weapon. So he put it, I believe he put in legislation, or he commented at least about it, that here you have children that are just horse playing, and now they're being treated as now they're being potentially suspended or expelled because it's being treated as a weapon. So where it's that delicate balance that they're just trying to find.
All right, thank you. Is there any other questions from the subcommittee? Is there anyone, you've already heard some concerns expressed, is there anyone in the audience that would like to articulate concerns as well? Concerns?
Yes.
And first anyone concerns, and now, all right, seeing none, although you've got someone on the subcommittee.
Speak in favor, Mr. Chairman.
Now those that would like to speak in favor and perhaps answer some of the questions. Sir?
Good morning. Thank you for this opportunity to talk with you. My name is Dr. John Matter, and I'm a medical oncologist in Newport News. In our area of medical expertise, we see a large number of patients who have skin cancers, basically all of them caused by sun exposure. These are not children in high school or younger. It takes probably 20 years to get a skin cancer from sun exposure. But as I think most of us know, we live in the Sun Belt, which has a very high incidence of skin cancers. And we feel it's important to educate these youngsters, to allow them access to good drugs, to permit or prevent the formation of skin cancers later on in life. All skin cancers basically are totally preventable if you don't have excessive sun exposure. And I and my group see a lot of patients with skin cancers. We understand that there's a potential conflict because of the medication versus a topical over-the-counter product that's been FDA approved. But I think it's important, especially with the number of young children that are participating in extracurricular activities such as soccer, field hockey, things like this, where there is more sun exposure than the usual 5 or 15 minutes of recess that we all had when we were coming along. So I would very much support this move. We think it starts the education process that hopefully will carry on to adult life for sun exposure prevention of skin cancers. I'd be happy to answer any questions you might have.
So, Mr. Chair.
All right, is there anyone else in the audience that'd like to speak? All right.
Mr. Chairman.
All right, real quick, I
yeah,
think
real quick.
there's a question for you, sir.
I'm-
Sarah Carrico asked you a question. Are you happy to take questions, sir?
Yes.
All right, Sarah Carrico.
So hearing what Dr. Dunn had said about treating these topical sunscreens as any other drug that is over the counter, what makes this any different than the Claritin, the ibuprofen, all the things that school boards now can allow in there? What is it about the topical cream that doesn't allow them to do it now?
I'm not sure the technicalities or the legalities of that. This is a topical preparation. I don't believe anyone has ever abused it by taking it internally. And I would suggest that of all the medications that a student could bring to school with them, this would be the safest one that they could bring.
Thank you, Sarah Carrico. Thank you for entertaining the question. Ma'am, would you like to speak?
Yes, Mr. Chairman, I'm Janet Harrison with the Virginia Municipal League. We actually do have a policy position in support of this, and it came out of Newport News, and I think it is one of those things that's a Dillon rule issue about making sure that you have the authority to allow this in your schools. And anyway, so we do support this measure. We think it's a common sense measure.
State laws banning anything from schools.
All right, does that exhaust those in the audience that would like to speak on this one way or the other? All right, we're now, it's now time for a motion. Senator Donovan.
I will just simply say that this is what happens so often in the legislature, a noble goal to get more kids using sunscreen on a regular basis. They're exposed when they're at school. The problem is that sometimes the ends that we develop through legislation, A, do not help us achieve that goal. A permissive policy to allow sunscreen at school will not necessarily increase usage. We're gonna need education for that. And B, it's just cumbersome. It's cumbersome legislation that we patch on with good intentions, but there are consequences for things that we legislate. And the consequence of this is the potential that we will be listening to regulating every single substance that people want to have in schools. This is best kept at the school board level. They have the power. Dillon rule does not interfere with the school board's power to determine policy on medication. So I would move that we PBI this.
Is there a second on that motion? All right, the motion is that the subcommittee recommend the full committee pass this bill by indefinitely.
Mr. Chairman?
Senator Barker, would you like to speak to that motion?
I'd like to make a substitute motion to report the bill. As someone who's never had a suntan in my life, and does have to visit the dermatologist on a regular basis, including during session here, to basically get the free spray to try to prevent the precancerous things. I think it's important that we make sure that all students in Virginia are allowed to be able to have topical sunspray.
So there's a second on the substitute motion, which would be to recommend to the full committee that it be reported. Any further discussion on the motion to report? Seeing none, as many as favor the motion to report will vote aye.
Aye.
As many as oppose that motion will vote no.
No.
That motion fails with 2 affirmative votes and 4 negative votes. We're back to the earlier motion, which was to recommend the bill be passed by indefinitely. Any discussion on that motion? As many as favor that motion will vote aye. As many as oppose that motion will vote no.
No.
By a vote of 4 to 2, the subcommittee recommends it be passed by indefinitely. Thank you. objection, we are gonna have House Bill 1378 go by for the week. There being no objection, House Bill 1378 is the nurse practitioner bill, that's gonna go
790.
by for the week. 793.
Not 13.
Oh, well, you live the other one. All right, I'm gonna rephrase. 793
Thank you.
will go by for the week. There being no objection, that's by for the week. We now, go back to our regular order. Delegate Byron, it's House Bill 1003.
Thank you, Mr. Chairman, members of the committee. House Bill 1003 deals with a bill that I know some of you on the subcommittee in particular worked, Senator Barker and Donovan worked with me last year in changing a lot of changes that had to do with COPN and healthcare data reporting and the definition of charity care. And this bill just basically puts a little bit of teeth into the language that we required a report back to the General Assembly. I was quite dismayed in the fall after the bill passed to go to one of the workshop meetings and discover they were still struggling with how to implement this bill. And we had clearly defined in the code how it was supposed to be implemented, and still tossing this thing around, and I feel like we're losing very important data that we could and have been waiting for to be able to ensure that the proper levels of data are being recorded and the proper level of charity care that is stated is being done. So that's all the bill does. It creates a penalty for not reporting, and hopefully will, the hospital groups have not opposed it in the House, and hopefully you will not either.
All right. Is there anyone on the committee that has any questions for the patron? Is there anyone in the audience that has any concerns with this bill? All right, so on good track. Is there anyone that feels the need to register public support for the bill? All right. Is there a motion?
Recommend reporting.
Second.
There's a motion to recommend report. Seeing no discussion. As many as fair that motion will vote aye.
Aye.
As many as opposed, I vote no. And that recommends for report on a 5-0 vote. Thank you, Delegate Byron. Delegate Price, you've got House Bill 614.
Mr. Chair and members of the committee, House Bill 614 would create a mid-level license in social work. As you know, currently there are 2 levels in licensure: the LSW licensed social worker, which currently combines both bachelor's and master's levels, and the licensed clinical social worker, or LCSW. HB 614 would split the LSW into a bachelor's level and a master's level, creating a LBSW and an LMSW. There would be no impact on exemption settings, and there's no impact on the scope of practice. Only the titles would change, and the bachelors would still do the casework with no changes to their current responsibilities. But most LSWs obtain licensure for professional recognition and access to employment opportunities, and social workers with a master's degree may be more inclined to obtain a license if that license recognizes their master's level of professional education and training. The LMSW would still have a supervisory role for the LBSWs, while simultaneously possibly working under supervision towards their clinical license. And the National Association of State Boards of Social Work has been working to align the licensing structure across the country. And for Virginia, this could actually create a workforce opportunity, making it more attractive for the master's level social workers to move into Virginia, having their credentials recognized. And that is important. As you know, we have a shortage of social workers, but not a shortage of need.
Thank you, Delegate Price. Are there any questions from the subcommittee for the patron? Is there anyone in the audience that has any concerns about this legislation? Is there anyone that feels the need to register public support for it? All right, is there a motion?
Recommend report.
All right, we've got a motion to recommend report to the full committee. Any discussion on that? As many as favor that motion will vote aye. Many as opposed, that will vote no. And on a 6-0 vote, it's recommended to report. You do not need to come to the full committee for this bill.
Thank you.
Delia Freitas. You have House Bill 541 for us.
Thank you, Mr. Chairman. I do have one minor line amendment.
Does council have that?
No, they do not. I just recognize that it hadn't gotten submitted. But all we're changing is if the amended version that came out of the House, we said consider the efficacy of alternative treatments, and then they were supposed to submit a report to the chairman on House Committee on Health and Welfare. And then the Senate Committee on Education for by November 1st, 2018, they've asked if we could extend that to 2019, and I consider that a friendly amendment.
Well, it's friendly since the patrons proposing it. Council, do you have that amendment? Do you just want to report the line number it's on, the very last one?
Yes, sir, line 24 after November 1st, strike 2018, insert.
Thank you. Is there a motion on the line amendment?
I'll move the line amendment.
Second.
As many as favor adopting the line amendment will vote aye. Opposed? All right, we've got the amended bill before us.
Thank you, Mr. Chairman, and essentially the purpose of this bill is just for the department to test the efficacy of various alternative treatments for veterans, specifically with PTSD and traumatic brain injury. Right now, there's a lot of different treatments that are coming into place that we can do with service dogs and whatnot. And some of this we already use, but we'd like to get a more robust analysis going so that we can determine what sort of services we might want to make available to veterans dealing with those particular issues.
All right, thank you, Delia. Are there any questions from the subcommittee for the patron? Senator Donovan.
I will, be honest with you, Dr. Freitas, that I'm concerned about this bill. One of the major reasons I'm concerned about this bill is that it says you need to have at least one scientific medical peer review study. That is a poverty of scientific evidence. A single study can tell anything. And I'm concerned, this seems like an incomprehensible amount of work to me, because if you took everything that there was one study that showed it might have efficacy, studies in medicine are not reliable until they've been duplicated at other centers and we verified that the results are the same, so that there's so much more that goes into developing standard of care and best practices in medicine. I'm concerned that you're relocating this from the brain injury specialists who are recommending best standards of care. I would be more comfortable if you were to say that brain injury specialists dictated best standards of care that were not covered by the VA, but you're asking the Department of Health now to do a standalone analysis of best practices, and they're great, but they don't have that expertise. So I don't know how much information you're gonna get out of this report, and I have concerns that this is beyond the scope of what we should be doing as a state. I know your intention for the VA, and I'm in favor of that, but there's some significant concerns about how, if I were the Department of Health, I'd be very concerned. I don't know if anybody here is here from the Department of Health. No.
Are there any other questions from the subcommittee for the patron? Is there anyone in the audience that would like to express any concerns? Is there anyone in the audience that would like to speak in support of the bill? All right, it's time for a motion.
Move the report.
Is there a second? All right, we've got the motion before us, properly seconded, to recommend report. Any discussion on that motion? Senator Barker.
I share Senator Donovan's concerns about how we dictate this here in this particular situation. I understand the intent of what you're trying to get at, but I'm not sure this is the best approach to get there, and I think that's subject to unintended consequences.
discussion from the subcommittee on this motion? Delegate, would you like to address the concerns that have been raised?
Yeah, I would just say that at this point, we try to make this incredibly permissive. There are a number of treatments that are starting to become available to veterans which are not as pharmaceutical in nature. And we've seen some success with that. We put the, one scientific review, but obviously, the board would still be within their rights in order to determine what it was that they wanted to consider. Again, the goal here is just to get the conversation moving a little bit more, to provide more information to the General Assembly, so that we can look at what potential treatments might be appropriate for assisting our veterans. But again, this doesn't require anything except to report back to us.
Senator Duckman.
I'm probably gonna abstain on this because I want to do something for the veterans, but I'd love to have a conversation about maybe changing this language to the department reviewing best practices nationwide for brain injury, because I think that allows the subject matter experts to, I'm sure if you were to do that, you're gonna find lots of things that are not covered by the VA, but they have more substantiating evidence and it's less kind of onerous responsibility on the VA. So with the intent that we can have some sort of conversation and look at an amendment time, then hopefully it can go to committee and we can discuss that there.
Senator Parker.
Do we have a motion yet on this bill?
The motion properly before us is to recommend report.
Was there a second?
And we've already had one senator announce that she's going to abstain.
Yeah, what I did make a substitute motion that we
Yes,
send
sir.
it to the full committee without recommendation at this point, which will give time for the paper to work with Senator on this issue and hopefully get it clarified before we get full committee.
Is there a second on that?
I second that motion, and Mr. Chairman, I don't know whether this is the appropriate thing to say or not, but I see a lot of these bills come up from the House with 100-0 vote, which means that they must have seen some merit in it. So I'd like the full committee to consider it as well.
It's very charitable of you to speak of the House in such a way. I was gonna say, man, no one looked at it, but, Senator Carrick.
Just for purposes of, and I understand which way this is going, this is traumatic stress disorder and brain injuries are something that the Joint Commission on Healthcare has been looking at for a couple of years, and the growing number of those veterans that are being affected by this. I think, if we do recommend without reporting it to the committee, this is something that could have an in-depth study over the year to see how the scientific researches are going, that's mentioned in this bill. And it would probably be one of the bills that would have to be looked at really in depth on that committee, because I don't think this issue is going away. I think it's getting worse every year, and it's something that we have got to address one way or another. So with the recommendation that we send it to the committee without a recommendation, that's something that I think the patron and others need to talk about, to see if he wants to get an extensive study done on it, to where we can have something next year that we can really make work.
Thank you, Senator Carrico. And for those of you that aren't familiar, Senator Carrico is the chairman of the Joint Health Care Commission, so when he talks about them looking at it, that's a pretty good point of what might happen there. Delegate, I think what you've got here is you've got 6 folks that like your idea, but you don't have 6 folks that like your bill as it's currently written. So what you're gonna need to do is work on this between now and Thursday, see if it can get in a form. If it can't get in a form by then, I think what you're gonna see is broad support for it to go to the Joint Health Care Commission, where the chair has said he's gonna use his influence to make sure we get these services to our veterans. So with that, we have the motion before us, which is to advance the bill to full committee, with no recommendation. As many as favor that motion will vote aye.
Aye.
As many as opposed, that will no. On a 6-0 vote, that will be presented. So what you're gonna need to do is work on this bill between now and Thursday, and you're gonna have to presume that you will be presenting, and if it And if you know that you don't have the votes, in that situation, we ask you to say that up front, and we will then send it to Joint Healthcare Commission where you've got a really good hearing coming from the chairman. So thank you, Delegate.
No, thank you, Chairman, members of the committee.
Delegate Garrett. You want that, or I know you've got to
He
go
is the
chair of
chairman,
full
yes, sir.
committee.
This should be very quick, Mr. Chairman. Mr. Chairman, members of the subcommittee, House Bill 879. Last year, we effected legislation where the nursing home inspections basically wouldn't happen until all had been seen. The challenge that created the problem is there are federal requirements for inspections as well, and so what we actually did, meaning to, was creating duplicate workloads where they would have to see it in a time certain for federal, but it was before they had seen all others for state. All this bill does is makes within the exception that when performed in conjunction with an inspection required under the federal provisions, it could happen and would then count as the state inspection as well, so that it reduces that same term. That's all the measure does. No better efficiency.
Thank you, Mr. Chairman. Are there any questions from the subcommittee membership? Is there anyone in the audience that has any concerns about this legislation? Is there anyone that feels the need to register public support for this bill that's already in a good way? All right, seeing that, is there a motion?
Yes, sir, Mr. Chairman, I move that the bill be recommended for reporting.
Second.
All right, any discussion on the motion that's properly before us to recommend a report? Seeing none, as many as fair, that motion will vote aye.
Aye.
And those opposed, that's 6-0. Do not need to come to full committee. Thank you.
Subcommittee. Very good, Doc.
Delegate Garrett.
Thank you, Mr. Chairman. Good morning, Mr. Chairman, members of the committee. Good morning.
Good morning.
You have before you House Bill 1303, and this provides that a veterinarian shall not prescribe medication unless a bona fide veterinarian-client-patient relationship exists. This is driven by recent changes January 1 of 2017 in the veterinary fee directive at the federal level. They basically said that all veterinarians have to have a bona fide relationship with their clients, and which are the farmers, and with their patients, to now be able to add different things to fees like antibiotics and different sorts of things that are relatively used. This put an undue burden on our veterinarians to now have a relationship with each individual bee within a hive, or each individual cow within a herd, or each individual chicken within a poultry house. So what this language does is basically, it covers, it changes our legislation to actually describe what that bona fide relationship is, and it will allow our veterinarians to practice in the manner in which they're correct.
We're legislating common sense.
In a sense, Senator, yes, sir.
Are there any other questions from the subcommittee?
Only to correct the federal government.
I think you should have said that on the microphone. Is there anyone in the audience that has any concerns about this legislation?
Move to report.
And anyone that traveled all the way for this bill?
From the hives.
That's right. All right, we've got the motion. Is there a second?
Second.
All right, the motion properly seconded is to recommend a report. Any discussion?
The only discussion would be if Senator Stanley were a veterinarian, he might want a relationship with every.
Yeah, serving on Senate Agriculture is a special experience with him. All right, so we've got the motion before us. As many as favor will vote aye.
Aye.
Any as opposed to that? And on a 6-0 vote to recommend a report, you do not need to come to full committee.
I thank the chairman of the committee.
Delegate Ingram. You've got House Bill 1524 for us.
That's it. While you look at that, let me tell you, since 1955, family practice in Hopewell and Colonial Heights have been in business. What has happened is they have, and I have Dr. Bush here and, from family practice, but the father, the son, the grandson, and there was this on the Moore side, they're still in practice, but all of them are deceased except for the grandson. Well, anyway, the son, I'm sorry. But he's retired, he's not living. And in the current law, you have to keep records if you're still seeing the patient. I think I'm saying right. If I say something wrong, let me know. You have to keep these records. Well, they've got 3 storage bins of records, and hospitals only have to keep them for 5 years, doctors, I sold Hopewell in an office in Hopewell. The man retired. He bought me a storage bin if I would store them for him, so I stored his records, and after 10 years, 6 years is all you have to keep them, but I stored them for 10 years and then shredded them. What they're asking for is, they're asking for permit now since 2006. They've had these on computer, electronic, but they want to be able to destroy these other records with the exception in the law of someone that say they saw as a baby that has not reached 18 yet, which wouldn't be very many, but they would keep those records. That's all this bill does, is give them permission, because they've been keeping records. This coming May will be 12 years electronic. That's all this bill does.
Thank you, Delegate. Senator Donovan.
Mr. Chairman, I have a question for council. I was under the impression that it was state law that you only had to keep for 6 or 7 years and then you could destroy records. Are we duplicating?
Let me call him Dr.
Thank
Bush,
you.
because he's just.
Other than the
Bush stand
18,
up.
under
Well, let's
18-year-olds.
hear council's take, because that's who the question was directed.
I believe under, regulation is 6 individual practitioners have to keep for 6 years following the last patient encounter.
Okay, so that's the issue.
And see, the issue is they're still seeing some of these patients, they're 70 and 80 years old, but they're still seeing them. That's the problem.
Are there any other questions from the subcommittee?
Mr. Chairman, I think there's peace in the valley with everyone, the medical people, I don't think.
Well,
Senator Lucas.
No, I was gonna say that I certainly share the concern, because let's say, for example, if you have 500 patients, that's a heck of a lot of records to have to store. And I can identify with it because I don't have that many patients, but I sure have a lot of records to store, and I know about how those storage bins fill up quickly. So I see the merit in the legislation.
Senator Donovan.
Tom, is there federal law? I don't know enough about this, but if you've transitioned all your patients that you're currently seeing onto electronic medical records, then, I don't know if the language is inadequate in law to clarify that, but, I am concerned that this seems so unlikely that the federal government has failed to regulate or legislate this issue, as much oversight as there is involved. And so I don't know if you've already explored all of that, Delegate Ingram. Have you looked at federal law?
Could I ask Dr. Bush to answer these questions, please?
Sure, 1 second, we're gonna see if we have any other questions, and then he can answer all of them at once with his perspective. Are there any other questions from the subcommittee? All right, is there anyone else that has concerns about this legislation, so then the side that supports it can answer all the questions that are provided? Anyone else with concerns in the audience? All right, now for those in support, and specifically, it'd be great if you started off. Please identify yourself and come up and speak to the microphone.
Tell them what the problem is, okay?
Thank you. My name is Dr. James Bush. I'm a primary care doctor working in internal medicine and pediatrics, working in Hopewell and Clinton Heights. The issue is, like he stated, the current law states that it's 6 years from the last time you saw the patient. That is also standard for hospitals, which is 5 years. So being that about half of patients don't have a primary care doctor, within about 5 years their records are already destroyed. And to your point with the 500 records, we have about 60,000.
Oh my God, I mean,
and the burden of going through those
That was
and
arbitrary.
determining back to 1955 would be great. And since we have been through 2 computer systems, we're going to our second now, we would have to look in 3 different places to see who had been seen in the past 6 years. We know we'd have to pull the records for the people that are older, and we've already done that. We moved about 3 million pieces of information into our new computer system from our old computer system, but that doesn't count as a complete record unless we have every telephone encounter where somebody asks for a refill or something like that. So we've used our discretion to pull correspondence from doctors' offices, operative reports, colonoscopy reports, and there's no recurrent items in a record that go past 10 years than colonoscopies and tetanus vaccinations. So what we're asking is what many states have done. There is not at this time that I'm aware any federal 6 years, a much shorter. So we chose 10 years because that's the furthest out that any other state has gone at this point. Some states have no recommendation or no current actual regulation, but just some recommendations. So what we're asking is to be able to go through those, keep the charts for patients that are 18 years and younger, and be allowed to remove the other charts from the storage units, that many of which are as old as 65 years old. And like I said, we currently have 4 storage units that we purged down to 3 storage units. And we really don't like to have those because the burden of maintaining security on those, so security numbers in them, that sort of stuff, we really like to be able to get rid of those. No one, lawyers, doctors' offices, hospitals, pharmacies, no one has asked for anything over 5 years old in many years from those charts. It's well past the statute of limitations for any legal cases, and no one has actually even been to these storage units in over 5 years.
All right, thank you. Senator Donovan.
So my only comment on that would be is that we are passing a specific piece of legislation for a single business entity. And if this is best practices for Virginia, then maybe this needs to go into the code more clearly and be consistent for everybody so that there is a standard. But Tom, did you have some information? No, but I don't.
All right, we've got the bill before us. Delegate Ingram, would you like to say something else?
Just in final comments, in answer to the senator's question and concern, I think that I'm not sure. That's why we made it a Section 1 bill, because I don't know if there's another place in the state of Virginia that has been continually in business since 1955. Because most of them have either sold out or resigned.
All right, thank you, Doug Ingram. I think that it might not necessarily need to be 1955, but I think that's where this subcommittee is concerned about. 1, federal legislation, and 2, you know, if this is good for one, it's probably good for a lot of other practices in the Commonwealth. Is there a motion?
Mr. Chairman.
Sarah Lucas.
Question, please. But because it's a Section 1 bill, there will be nothing that will prohibit us from coming back another time and fixing it if in fact it does have to have federal application. Yeah.
I mean, we could fix it Thursday.
Well, yeah, we could, but I mean, I have no problem with voting for Section 1 bill and then maybe come back another year, another time, somebody else's bill. Right now, I'm concerned about those storage bins. I only have 3.
So would you like to make a motion, Sarah?
Yes, sir. Yes, sir, Mr. Chairman, I recommend bill be reported.
Is there a second? Second. Any discussion on the motion, which is to recommend report to the full committee? Seeing none, as many as favor that motion will vote aye.
Aye.
Those opposed will vote no.
I'm gonna abstain for debate.
Yes. All right.
I'm going to vote no right now, because I'd like to know the federal law.
A little more information. What are hospitals doing?
All right, real quick, to make sure we get the vote right, Sarah Lucas, your vote is for your motion.
I vote to report.
Sarah Parker.
Yes.
Sarah Donovan.
Abstain.
Sarah Carrigan.
No.
And so it's gonna be 2-2-2, and it's gonna come out without a recommendation. You've got, I think you've got those of us that wanna help you out. With that interesting of a vote, it will be marked, and we will be able to see. One, we're gonna ask counsel, he doesn't have enough to do, so he's gonna look at the federal law between now and Thursday. And I think you got some of the rest of us that think it can be a Section 1 bill for everyone too. So,
Yeah, I can be a yes as long as I know the federal law allows it.
yeah, you might end up with a 15-0 vote on Thursday, but we just wanna have more discussion between now and then.
And on Thursday, when do you meet Thursday? Because I'll have to.
Thursday at 8.
8 o'clock?
Yes, and it goes long. So the other person that you'll want to talk with is the chairman of the full committee, Senator Newman. You'll want to stop in with him.
Mr. Chairman.
Senator.
Delegate Riley, Delegate Ingram, would you be opposed to expanding this for the whole state, so we improve the
Not at
code
all.
if council finds it's acceptable.
Not
And
at all.
and it's the right part of the code and everything.
Well,
I'm fine if
yeah.
all we can do is a section 1, but if we could just get this done, I'd be happy with that too.
I have no problem with that at all. In fact, I was trying to make everybody happy. That's the only reason I put it this way. It was not planned this way in the beginning. But the reason I made it a section 1 bill is because I knew what they, see, my daughter works in their firm.
Do I think you better stop where you
And
Yeah. Enough said.
Seriously, and she has been on me about this. She said, we're
Hello,
paying,
Riley.
she said, we're paying $400 some a month.
We'll
for
talk to
storage
you,
bin."
we'll talk to you on Thursday.
Thank you for giving us something to discuss between now and Thursday.
Man, great program.
Trying to help you out here.
Yeah, enough said.
We now have Delegate Robinson, and for those of you that might have stepped in, the nurse practitioner bill has already gone by for the so now we just have 1378.
Thank you, Chairman and members of the committee. 1378 is in Virginia, we have registered surgical assistants. And when the language was originally drafted, it left out what they did on renewal of their licensure. And all it says is to be continue to being a registered surgical assistant, you have to uphold your national credentials. And that's what it amounts to.
Thank you, Delegate Robinson. Are there any questions from the subcommittee's membership? Is there anyone in the audience that has concerns about this legislation? Is there anyone that feels the need to register public support for it? All right, is there a motion?
Yes, sir, Mr. Chairman, I'm looking at a 100-0 vote again, and I really want to try to help Delegate Robinson since I voted against her last bill. I recommend it be reported.
Is there a second? Any discussion on the motion? As many as favor the motion to report will vote aye.
Aye.
As many as opposed will vote no. And on a 6-0 vote, it's recommended to report. You do not need to come to full committee on this, although you might see you there anyways.
Thank you very much.
Delegate Boysko, House Bill 1088.
Great. Mr. Chairman and members of the subcommittee, I have HB 88 before us. My bill will ensure that all emergency department security guards at Virginia hospitals are trained to identify and safely address situations involving patients or other persons who pose a risk of harm to themselves or others who are experiencing a mental health crisis. The number of people seeking treatment for mental health emergencies continues to grow. In 2016, there were an estimated 10.4 million adults aged 18 or older in the U.S. with serious mental illness, and this number represents more than 4.2% of all of U.S. adults. An estimated 1 in 8 emergency room visits involves a mental health or substance abuse condition, according to the Agency of Healthcare Research and Quality. Far too many people with mental illnesses are in jails and prisons due to inadequate mental health treatment, and when a patient threatens or attacks a hospital staff, they may be arrested, and everyone loses when we criminalize a person with mental illness. The patient may also be injured. I filed a bill at the request of a constituent who's a mental health advocate who knows of many incidents where people seeking treatment ended up with criminal charges or injuries. There are many fines, hospitals in Virginia, and many hardworking staff, including security guards. Everyone would benefit if they were trained to de-escalate these conflicts. Some hospitals may train their security staff, but it's not currently required. And we believe a person's zip code should determine the way they're treated in our emergency departments. I hope it is the pleasure of the committee to report this bill.
Thank you, Delegate. Are there any questions from the membership of the subcommittee? Senator Donovan.
So, 2 questions. I don't see anybody from the hospital administration here, so I'm guessing they're happy.
Yeah, I worked with them throughout.
Oh, sorry, didn't see you, Brett.
It's okay. Brett Rawlings, Virginia Hospital and Healthcare Association. We did work with them for school language.
And I think my only follow-up question is, just for consistency of language, I think we're using trauma-informed education. And I think that that's what we have for CIT for our police force and everything else. And I think it would be nice if we could get the language,
Okay.
That's what we need to have for teachers is trauma-informed. And so if you would consider maybe re-wordsmithing this before Thursday,
I would be happy.
because those training programs already exist as well. We can tap into the same CIT training programs that our law enforcement officers are using. And so I think that might help us just align all the entities because they would be trained in a similar way.
I'd be,
Do you have an amendment you'd like to offer?
I think she and I can work on that between now and then. Tom probably has it. Yeah, Tom's got it.
Is there anyone in the audience that has any concerns about this legislation? Is there anyone in the audience that would like to register support for this bill?
Mr. Chairman, I brought up this with NAMI Virginia. The constituent is a member of NAMI Virginia that requested the bill. We support the bill and the amendment as well. Thank you.
Great, thank you. Yes, sir.
Bruce Cruiser with Mental Health America of Virginia. We also support the bill. And we think it's in the interest of everyone's safety.
Thank you. All right. So first, everyone understands the amendment that Senator Donovan's proposing that we'll be considering full committee. So
just one question.
Senator Carrico.
So, in the statistical numbers that you used, how many are truly a mental health crisis opposed to a substance abuse issue? Because the training that Dr. Donovan is explaining, which I agree with, I think it needs to be in there, does differ from someone who's truly in a mental health crisis opposed to someone who's a substance abuse situation.
thank you, Senator. According to what I have, percentages of hospital admissions for mental health treatments in 2012, the most recent thing I have is 2012, 8.6 million inpatient stays involved at least one mental disorder or substance use disorder, accounting for 32% of inpatient stays. I do not believe I have it broken down between substance abuse and mental illness, however.
And that I think is important because in this training, you're gonna have to utilize an extensive, identification of which ones are a mental health crisis and which ones are a substance abuse crisis. You're gonna have to delineate that, because you can't de-escalate someone who is
Correct.
high on crack cocaine.
Thank you, Senator Carrico. Any other comments? Everyone understands the amendment? You've got that? Good. Is there a motion on the bill with the understanding that it will be seeking an amendment?
Will the bill be reported?
Second. Any discussion on the motion to recommend report with an amendment that will be drafted between now and full committee? Seeing none, as many as favor that motion will vote aye.
Aye.
As many as opposed will vote no. So it's a 6-0 vote. It was recommended for report. You need to work on the amendment between now and then, presuming that you've got an amendment. Senator Donovan will do a good job of being able to read the committee. And so if you've got an amendment that she's good with, that will likely carry the day. And if that happens before Thursday morning, you will not need to show up. If you don't, then you need to show up.
Okay. Thank you
And
so much.
I believe that completes our docket today. Thank you all for coming.